All content in this video, including but not limited to text, graphics, images, audio, and video, is the property of Toward Health and is protected by international copyright laws. Unauthorized distribution, reproduction, modification, or use of this content without prior written permission from Toward Health is strictly prohibited. For permissions, please contact us at contact@drtro.com.
Happy Saturday, everybody. Thanks for joining. So I'm going to be discussing some different medical considerations you should be thinking about if you are starting a ketogenic diet or maybe already on one. We're going to first talk about how powerful of an intervention a ketogenic diet can be. Then we're going to discuss some side effects that you should be aware of and potentially how to avoid them. We're going to discuss some supplements and also the impact that alcohol can have on your body and how being on a ketogenic diet can impact alcohol tolerance, and then discuss some of the most commonly used medications and what you may need to be thinking about in regards to those medications while on a ketogenic diet. So first, a ketogenic diet is a powerful intervention, and I love this. The results here are from a pilot program that we did as an employee wellness program. And you can see the average BMI there was 45, just under 300 pounds. And over the course of 6 months, there's over a 38-pound weight loss, drop in an A1C of 1.1%, and systolic blood pressure improved by 17. I want to highlight that all those benefits occurred while deprescribing numerous medications for diabetes, blood pressure, insulin, and other medications for reflux disease and cholesterol. So you can imagine the benefits on A1C may have been much more if those people had continued those medications, but it's very possible too that actually they could have had dangerously low blood sugars had they continued those medications while making the big dietary changes. Additionally, there have been other studies published that have shown benefits in mental health, from anxiety and depression to schizophrenia and bipolar, eating disorders like anorexia, binge eating disease, diabetes, hypertension, metabolic syndrome, obesity, fatty liver, probably the most literature around that area. Some studies even on showing benefits in people with cancer, certain skin conditions, and even autoimmune diseases like rheumatoid arthritis and Crohn's disease. All right, so let's say you started the ketogenic diet. What are some side effects you want to keep an eye out for? Often these side effects are happening just because your body is adapting to a low-carb, high-fat diet. It's going from a sugar-burning machine to a fat-burning machine. Hormonal changes are going to be happening. If you had really high insulin levels previously, insulin levels are going to be coming down, which is great, but there's going to be a shift of electrolytes and fluid in your body that is going to take some time to adapt to. Additionally, your body's going to be excreting more ketones initially before it starts retaining more of those ketones. And most of these side effects require no or minimal intervention, but if you are proactive, you can actually avoid some of them in the first place. And if you're a patient of ours, we always encourage you to please reach out to us anytime so that if you are experiencing these side effects, we can try to avoid them or treat them quickly. The keto flu is probably something that many people have at least heard about, although not really sure what it is. And it's often described as lightheaded or dizzy, really fatigued, maybe some insomnia or irritability, headaches, brain fog, not thinking quite clearly, some nausea. And very often this is actually just due to not getting enough salt or drinking enough water. Again, those electrolyte shifts that are happening oftentimes from your insulin levels dropping a lot and the kidneys no longer holding on to as much salt and water can actually create a lot of those above symptoms. So if you get 5 to 7 grams of sodium per day and drink enough water where your urine is clear or mostly clear, then you might prevent this in the first place. Now, if you have heart failure, kidney disease, hypertension, some other medical conditions or medications, you may need to discuss with your provider, is it safe and how much should you be having? Other foods that can be great sources of sodium: olives, pickles, sauerkraut. Salt your food to taste. Many people are told to avoid the salt shaker, but If you are removing all of those processed foods that have tons of salt added, you really probably need to salt your food. You can do that to taste. And then there's also electrolyte mixes that can be really helpful. Example is Relight, and I really like to use that one. I often do the unflavored one, and sometimes I put just a little bit of lime or lemon juice in it. Other times I just drink it a full scoop and 30 ounces of water. It's just a little salty. If you are exercising, especially if in your really hot climate or you sweat a lot, you may need more electrolytes than that. If you are suffering with muscle cramps, this could be from not having enough magnesium, sodium, potassium, water, or a combination of all of them. And again, you might want to try an electrolyte mix. If that's not doing the trick, then Steve Finney's written some great books. I encourage you to check them out, The Art and Science of Low Carbohydrate Performance. There's a technique that he'll have people try, which is 3 slow-release magnesium tablets for 20 days, and then continue 1 to 2 tab per day afterwards, and you can trial off of it, see if that prevents the cramps from coming back. Irritability and carbohydrate cravings. Most of the time, this is going to subside over 1 to 2 weeks. It's like a dial gets turned way down. Some people say it's even quicker than that. Some people it takes a little bit longer. The severity typically depends on how many carbohydrates you're consuming previously. I think it can be really helpful to have replacements readily available. And for me, I really enjoy my 100% unsweetened chocolate now, and that has acted to eliminate most of my carbohydrate cravings. Hair loss is something that sometimes people will bring up or concerned about, and this is not specific to keto, but any diet or major stress on the body may cause hair loss. And this is something that's typically called telogen effluvium, and hair will regrow 3 to 6 months later after this occurs. The other times that people might have telogen effluvium that they may already be aware of is things like pregnancy, infection, again, so any stress on the body. Insomnia can be a sign of keto flu, so we talked a little bit about that. So this could be trying hydration or electrolytes to help fix that. Sometimes, especially initially, people may not be fat adapted and they may just not be getting enough calories for them at this point. And so actually eating more calories can sometimes help people. Ketones can also increase energy levels for some people, and that can make it harder to fall asleep. I've had a few people who will eat some non-starchy vegetables before bed, and that can make a big difference. 1 or 2 actually who will use supplemental ketones or even a little extra fat. If you have been dealing with insomnia before the dietary changes, then you want to think about other things that could be contributing to that, like obstructive sleep apnea, hormonal changes. So a ton of women experience insomnia or sleep issues around the perimenopause or menopausal transition. Is your thyroid hormones adequate? Anxiety, depression, or mood symptoms can definitely contribute. And then always you want to be thinking about, is my sleep hygiene good? And if maybe sleep hygiene is really good and you're still dealing with insomnia and you've ruled out those medical conditions, then something that can be really effective is called cognitive behavioral therapy for insomnia. And you can do that with phone apps now. You can do that virtually or telemedicine. So it's worth finding help because sleep is really important. And probably sometime in the next couple months here, we'll actually have a more full sleep course on the app. But in the meantime, in our weight loss curriculum, our approach to lifestyles levers, you can go in there and find some more information on sleep hygiene and the sleep lever, how to help with that. Diarrhea is something that sometimes people will have to deal with. Again, this oftentimes, if it happens, will just go away on its own. Sometimes it's because there's a big increase in sugar alcohol consumption, so those can be found in a lot of the processed replacement foods. There are things like xylitol, sorbitol, mannitol, maltitol, and isomalt. Sometimes people who have previously tolerated their medicines like metformin or berberine as a supplement notice once they go on a ketogenic diet, they start having diarrhea, and then if they stop those medicines or the supplement, it actually goes away. Excess fat or protein is not oftentimes too big of an issue. Again, the body will just adapt and the diarrhea will stop, but sometimes that's something to consider. And then magnesium supplementation. Magnesium is something that most of us are deficient in, or at least probably half of people are. So it makes sense and is reasonable to supplement, but there are certain forms of magnesium that can increase diarrhea. So if you're dealing with that, you might want to consider switching to something like magnesium glycinate, which is less likely to cause diarrhea than something like magnesium citrate or oxide, which can. And on the other right side of the screen, you'll see something called the Bristol stool chart. And the goal really is typically to be around a type 3 or type 4. Less than a type 3 is more constipation. Above type 4, starting to think more diarrhea passing. And constipation is defined by hard stool pellets or really struggling to pass, not the timing of stools. Some people think they're constipated if they don't go every day, but that's not true. If you're passing well-formed, easy stools every other day or even every third day, as long as there's no issues, again, type 3, type 4, feeling very well, that's okay. Generally, it is not due to less fiber intake. Some people will actually notice if they get too much fiber, that can actually cause constipation, especially if you've just suddenly increased fiber intake rather quickly. That can be hard for the body to adapt to and increase constipation. Something really important here is to make sure you are adequately hydrated, so a minimum of 2 liters of water per day. And then some people have had some great success actually using MCT oil or powder if they're dealing with some constipation. Gout can be really painful. There's a picture there. I think my face is actually blocking it, but the other toe there is really red right around beneath the big toe. And that, again, it can be something that's really painful. The bed sheets even touching it can cause pain. And there's a theoretical increase initially for a flare when starting a ketogenic diet if you have a history of gout, because uric acid levels initially go up. But then after 3 months and beyond, levels typically go to baseline and actually even lower. And in Inverted Health Study, which was the longest interventional trial using a ketogenic diet, there were no cases of gout. And long-term, again, the risk typically decreases. And we actually can typically titrate people off of their medications they use for gout, like allopurinol, once they're well into the ketogenic diet, several months past kind of the initial phase. If someone has a history of recurrent gout, then it may be worth considering doing some prophylactic medication initially. So this is, again, just something you want to try to work with your provider on to figure out, is it necessary for you? In regards to kidney stone, there are several risk factors for kidney stones, from genetics, dehydration, obesity, diabetes, low dietary magnesium, high oxalate, and many more. There's a perception that kidney stones are much, much, much more common in ketogenic diets, but don't think that really tends to be true. In fact, in the Inverted Health Study, there were no episodes of kidney stones over the course of 2 years. The most common type of kidney stone in those following a ketogenic diet are uric acid stones, followed by calcium oxalate stones, and then actually having both stones. If you've had a history of kidney stones, again, hydration here is really important. At least 2 liters, really more like 2.5 to 3 liters per day of water. 4 ounces of lemon juice daily has actually been shown to decrease kidney stone risk, and this is something you would kind of spread out throughout the whole day in several diluted water, not just drinking 4 ounces straight. Also, you want to avoid high oxalate foods, so some high oxalate low carb foods are things like spinach, rhubarb, tofu, okra, almonds, and cashews. Potassium citrate is also a supplement that has been found to really decrease kidney stone risk. And again, you want to work with your provider to determine if that is appropriate for you. And there was a meta-analysis in several thousand people who were following a ketogenic diet, and there's an incidence of kidney stones of about 5.9% over the course of 3.5 years. And in one of the large kind of trials in the United States, just looking at prevalence of kidney stones from questionnaires and surveys, over a several year period, the prevalence was about 8.8% in the general population. So it did not seem to be a huge difference between the two groups. All right, moving on to supplements and alcohol. First, if someone is losing a lot of weight, it might be worth taking a multivitamin just to help cover your bases as you're losing weight. The other thing that we very commonly see in our practice actually are low vitamin C, vitamin D, B12, and folate levels. And so I would just encourage people, it's worth having your vitamin levels checked and then see could you benefit from taking an additional supplement, or try to really focus on either getting more sunlight or eating certain foods that are high in those vitamins. And again, I mentioned it earlier, but about 50% of people are likely magnesium deficient. And part of this is our foods are just nutritionally deplete now. So the average mineral content of magnesium, iron, calcium, and different vegetables has declined almost 90% over the past 100 years. So rather significant. In terms of alcohol, it's pretty interesting in that when you consume a ketogenic diet, your tolerance actually goes down. So you may be able to drink 1 glass compared to 2 and feel the exact same buzz. Additionally, it can increase carbohydrate cravings. One of the ways that this works is when you drink alcohol, your liver, instead of now making sure your blood sugar stays at a fairly consistent level, it is going to go focus and metabolize the alcohol. So say I have a glass of red wine, it's a very dry, not a sweet wine, a Moscato. My blood sugar might actually start going down. And as my blood sugar is going down, if I'm not eating anything else, I might actually start getting cravings for some carbohydrates or something to bring back up my blood sugar. The other thing is sometimes, especially if people are drinking more than 1 glass, that type of environment can oftentimes just be associated with higher carbohydrate consumption or late nights. And so that, again, that environment can increase carbohydrate consumption. If you are going to be having more than 1 beverage, it's definitely worth considering to alternate an alcoholic beverage with water. Alcohol also decreases quality and duration of REM and deep sleep. In the sleep course, we'll go into this a little bit more, but that's very important for overall health as well. And that's one of the reasons it can be important to try to avoid alcohol a few hours before bed, especially if you're having more than 1 glass, as again, that's going to really impair sleep quality. If you are drinking, then try to choose lower carb options like wine, liquor with soda or sugar-free diet soda, or low carb beers or seltzers. All right, now we're going to spend the bulk of the time here talking about medications. So I wanted to approach this by looking at the most prescribed medications in the country. So the top 10 medications by total prescriptions in 2022 are listed there. Atorvastatin, this is for cholesterol, almost 110 million prescriptions for over 28 million patients. It's pretty incredible. Metformin to help improve blood sugar, over 86 million prescriptions. Lisinopril for blood pressure, 82 million. Levothyroxine, help your thyroid gland, 82,000. 82 million. Amlodipine, over 70 million to help improve blood pressure. Metoprolol, heart failure. And then asthma, COPD, blood pressure medicine, reflux medication, and then pain or neuropathy medication. Next 10 medications, we've got several in this group here that are used for mood, a couple again for blood pressure, ADHD, allergies, and reflux disease. And tamsulosin is used for BPH or prostate enlargement. Last 10 medications that we're going to be looking at today, some of them. Again, several medications for mood, pain, heart failure, again, asthma or COPD, and then blood thinning, blood sugar, pain, and prednisone, which is used for a whole slew of medical conditions, but decreasing inflammation. We're looking at the number 1 prescribed medication for cholesterol, or atorvastatin. Also, you may have heard the term lipid-lowering therapy. Besides atorvastatin, rosuvastatin, simvastatin, many other common ones on the market now. Other types of lipid-lowering therapy include things like ezetimibe or bempedoic acid is a newer medication, and then Repatha or Praluent, which are injectables. So when I'm working with someone and considering lipid-lowering therapy, first thing I might consider, if they're in the midst of losing a lot of weight, their LDL might go up, but then it might actually stabilize and actually go back down again. Also, what are their other signs of metabolic health? What what are their HDL and their triglycerides doing, their lipoprotein insulin resistance score, and then maybe we get a calcium scan and look to see, is there evidence of any cardiovascular disease present? Some individuals may experience a really large increase in their LDL. This is typically seen in people who have lower BMIs. And if this is the case, it's, again, risk-benefit discussion. They can actually add starch or non-starchy vegetables back into their diet or fruit. And if they add about 100 grams, then oftentimes that can normalize their LDL. This is a phenotype that many of you may have heard now be described called lean mass hyperresponders, where you typically have a large increase in LDL while you also have a large increase in the HDL and a big drop in the triglycerides. Stopping lipid-lowering therapy is another risk-benefit discussion between you and your provider. If there's kind of a debate or, should we do this type conversation I'm having with someone, something I, again, like to consider is a calcium scan. And the incidence of, so this graph here is looking at risk or incidence of a heart attack based on statin treatment and someone's calcium score. So if we look at individuals who have a calcium score of 0, this top graph here, when they were on a statin over the course of 12 years, there was no benefit to them from that medication. When we look at the graph with a calcium score between 1 and 100, there's no statistical benefit. You start to see the lines separate a little bit, like maybe over a little bit longer period of time, maybe there might be some benefit to them. When we look, if they have a calcium score greater than 100, you see that benefit really starts to become more obvious, and they did have a decreased risk for heart disease. The calcium score above 400, same thing, there was a benefit in the group treated with statins. All right, in regards to blood sugar, I think this is one of the single most important things to be aware of, and that you may need to be working with a provider who can help you titrate certain medications. There are a lot of different medications. Again, metformin, one of the most commonly prescribed medicines. Now, much more commonly used, probably you've heard of them, are the GLP-1 agonist, like Ozempic, Mounjaro, Wegovy. And these medications can actually be really effective for some people. And I think there definitely is a certain group of patients that I really do think, again, get benefit, and I use them in my practice, just not as commonly or willy-nilly as sometimes people will use nowadays. You hear about everybody taking a GLP-1 agonist, even to just lose 15 pounds. Someone will take one of these medications. One of the concerns with these medications is you do tend to lose a little bit more of your lean mass compared to, say, losing weight through a ketogenic diet or through other types of methods or other dietary interventions. And so if someone is using these medications, it might be more important to consider doing some resistance training to combat some of that lean mass loss. Additionally, the trials show if you stop this medication, then the weight comes back and may even go higher than baseline. Now, we at Axtro and I have both had success in helping people where we might initially use these medications to help either with food cravings or get their diabetes under control, but then successfully taper them off once they've made those lifestyle changes without having subsequent weight gain or return of their diabetes. So it definitely can be done. I think you just have to work on the lifestyle changes at the same time, whereas sometimes in some of these online clinics, you can get prescribed a GLP-1 medication and then have no guidance on lifestyle change. In regards to the SGLT2 inhibitors, these medicines make you pee out more sugar, and I will talk a little bit more about them on the next slide due to a risk of something called diabetic ketoacidosis. The other two groups of medicines here I want to highlight are sulfonylureas and insulin, and that is because these medications can cause life-threatening low blood sugar. And the sulfonylureas that are most commonly used, you might hear of glipizide or glimepiride. If someone is starting a ketogenic diet and you are on these medications, almost always, same day, you need some kind of titration of these medications. And I highly recommend that you're using a continuous glucose monitor if you are on these medications to help try to catch any low blood sugars or prevent any complications from occurring. If, again, you are on any of these medications, highly recommend working with your provider to safely titrate them, because making this type of lifestyle change, you will need to titrate them. All right, a little bit more about SGLT2 inhibitors. Common ones are Jardiance and Farxiga. There's something called diabetic ketoacidosis, the ketone levels in your body getting too high where you might actually need admission to the critical care unit or the ICU. And the risk of this, relative risk, is 108%. That sounds huge. But if you look at the absolute risk, it's actually fairly small. It goes up by 0.13%, which is about 1 out of 770 people. Now, if you are on a ketogenic diet, it doesn't mean that you can't take these medicines, but you do need to be much more cautious because of this. If you get sick or are not able to tolerate food or stay well hydrated enough, then you should, again, talk with your provider, but consider stopping that medication until you're over that illness. Depends, again, why you're on that medication, so I have to be cautious, especially if used for heart failure. Another technique that we'll sometimes use for our patients if they're on this and eating a ketogenic diet is actually monitoring their ketone blood levels using something like a Keto Mojo device where you can check by doing a finger prick. And again, that way you can see what are my ketone levels usually, and if I'm feeling nauseous or feeling really poorly, check your ketones and make sure they're not going up too high. In regards to blood pressure, a lot of commonly used medications, four most common brand or categories being thiazides, ACE inhibitors, ARBs, and calcium channel blockers. In regards to the hydrochlorothiazide or chlorothalidone, these medications help you or make you urinate more. ACE inhibitors, lisinopril and allopril, as well as olmesartan and valsartan, will alter some of your kidney hormones, and then calcium channel blockers can dilate your arteries. Thiazides may cause some electrolyte issues, and with ACE inhibitors, the big side effect that some people will end up stopping the medication for is it can cause a persistent dry cough. And then in regards to calcium channel blockers, amlodipine can cause some leg swelling, which for some people can be really bothersome and may need switching medications. In regards to ketogenic diet, again, because your insulin levels are dropping so much, also the electrolytes or your kidneys are not holding on to sodium or water as much anymore, you may become over-medicated too quickly and start getting too low blood pressures. And this, called orthostasis, but getting really lightheaded, dizzy, feeling fatigued, or if you're going from standing or sitting to standing or lying down to sitting, again, getting that woozy, lightheaded feeling, all signs of too low blood pressure. It's important if you are on these medications, you do have a blood pressure cuff at home so that you can check your blood pressure. And you want to make sure after resting comfortably for 5 minutes, arm rested at roughly heart level, feet flat on the ground, not having just done a big exercise routine or run up the stairs, or really actually resting, and then check your blood pressure and see what it looks like. In regards to heart failure, there's two big categories here: heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. Reduced ejection fraction means less than 40%, where your heart is not pumping blood out going forward as well into the rest of your body. And this is typically due to having had a heart attack. There are a lot of medications used for this that really can improve quality of life, length of life, make a huge difference for these individuals with this type of heart failure. And there are medicines like furosemide, Lasix, sacubitril, valsartan, beta blockers, really common, metoprolol, Coreg, or carvedilol. And then now the SGLT2 inhibitors are also finding more evidence of benefit. If you start a ketogenic diet, there have been some new reports and a recent study actually showing ketones being beneficial for improving ejection fraction, and it's possible that you might be able to decrease some of these medications. This is something you got to work really closely with your primary doc, your cardiologist, so that you still may benefit from at least staying on small doses of all these different kinds of medicines for your heart failure. If you have heart failure with preserved ejection fraction, your heart is still pumping normally, but it may not be relaxing or filling properly. And this is typically due to hypertension, metabolic disease, a big association with obesity and diabetes, and age. And there are some medications, furosemide, spironolactone, that are used for this. Oftentimes, though, this is something where you may be more likely to actually stop these medications for this type of heart failure with a ketogenic diet and improving your metabolic health. In regards to asthma, the most commonly used medication is albuterol or rescue inhaler. So you have some wheezing, tightness in your chest, use the rescue inhaler, and that hopefully goes away. Maintenance inhalers, if your asthma is a little bit more severe, are typically inhaled steroids like fluticasone or budesonide. If someone is in an acute exacerbation, they're having a lot of wheezing, difficulty breathing, then oftentimes we'll actually use oral steroids. And there actually was a case report of symptoms significantly improving on a ketogenic diet. I have also had several patients who have been able to titrate off one actually maintenance inhaler, and then several people who no longer require their albuterol. GERD or gastroesophageal reflux disease, acid reflux, heartburn, kind of names for the same thing, often resolves on a ketogenic diet. I've been able to take a lot of people, thankfully, off of the most commonly used medications for this, which are the proton pump inhibitors, omeprazole, esomeprazole, lansoprazole, pantoprazole, and then the H2 blockers like famotidine or cimetidine. And these really are not benign medications, so if you are able to get off of these medicines, it's definitely worth it. There are certain types of worse reflux disease or Barrett's esophagus or other complications that you may need to stay on these medications. And then in that case, again, it's a risk benefit, and it's probably more beneficial for your health to stay on it. But that's just something you're going to have to work out with your provider. The reason I say if you are able to titrate off these medications, I would definitely recommend it, is there's some evidence that they may increase risk for kidney disease, osteoporosis, C. diff, pneumonia, and contribute to B12, magnesium, and iron deficiency. When thinking about thyroid medicine and ketogenic diets, oftentimes excess weight can actually make the body resistant to thyroid hormone, and weight loss can resensitize the body. So sometimes you'll actually see as people are losing weight over time, their thyroid stimulating hormone actually drops. Sometimes T4 can go up. The medicines that you'll typically see used are levothyroxine or Synthroid and liothyronine or Cytomel. The Armour thyroid is actually, or NP thyroid, those are desiccated pig thyroid extract that has a combination of both T3 and T4. Some people do really well on Armour or NP and actually feel better than if they were just on Synthroid alone. And then less commonly, but I have seen where it can be harder to keep levels in stable ranges with those medicines. In which case, sometimes Synthroid by itself or Synthroid in combination with Cytomel can be really helpful. So that's, again, something you just want to be working with your provider on. If you are not feeling great on your Synthroid, it is worth considering adding in T3. Additionally, if you've had your thyroid gland removed, then adding in T3 may be even more beneficial to you. All right, the SSRIs, SNRIs, and bupropion. So these medications are used for depression, anxiety, neuropathy, even menopausal symptoms, and other conditions as well. I think it's important that people understand metabolic health is mental health, and Metabolic Mind is a really great organization I encourage you to check out if you have not. But if you improve your metabolic health, oftentimes you may be able to titrate down or stop these medications. Looking at the SSRIs, the most common ones all listed there: fluoxetine, paroxetine, sertraline, citalopram, escitalopram, and then in the SNRIs, duloxetine and venlafaxine. These medications require very slow titration. If you suddenly stop them, SSRI or SNRI discontinuation syndrome can occur, and this can be terrible. Some people, it may have accidentally just forgot even to take their medicine for a day, and they feel terrible rebound anxiety. Sometimes they say electric shock sensations or zaps, I've heard. Feel really nauseous, maybe sweating. I had one patient who was, having panic attacks from stopping these medications too quickly. And some people can even say they're confused, they're not thinking clearly, makes them manic. So again, highly recommend you work with someone to help titrate off these medications. This is an example here on the next slide of how slowly you might actually want to consider tapering off of these medications. So if you're on a 40 milligram tablet, you might initially go to 35, to 30, to 25, to 22, to 20, 18, 16. Fast forward a little bit, 29 further steps, 0.15 per day, and then stop. And this was from the Royal College of Psychiatrists. And the thing that can be really tough, especially with the SNRI medications, is they don't have low doses tablets. And so if they have the capsules that actually have the very small beads, you can actually open the capsules, count out the beads, and then slowly titrate using that method by actually counting out the beads. And you may want to stay at a dose for a couple weeks before titrating down. If symptoms rebound or you do start having withdrawal symptoms, then you slowly go back up on the dose and then slowly titrate back down again. If there's a liquid formulation, which for a lot of the SSRIs, there are liquid formulations, you can use that to help during the titration period. In regards to pain medicine, improving metabolic health decreases inflammation, decreases weight, which can help with some of the stress on the joint pains, and may greatly improve pain. I've seen regularly that arthritis improves or just completely resolves. And what's really interesting about this is you'll see people whose arthritis goes away before they've had a lot of weight loss. And that's because there is an inflammatory component to the foods and things that we're eating in our diet. So when you remove that inflammatory piece, you have improvement in the pain. And that will enable you to get off of NSAIDs, gabapentin, or even narcotics if you're using those for pain. The gabapentin, hydrocodone, and oxycodone side effects, you can see some overlap there with dizziness or fatigue, somnolence. Gabapentin can also cause some weight gain or leg swelling and make people kind of woozy or not think clearly. And then everyone is probably well aware of that, unfortunately, with the oxycodone or hydrocodone opioids, that there is a big issue of overdosing and increase in death with those medications. All right, in summary, there are rapid metabolic improvements with starting a ketogenic diet, which is awesome. Because of this, you need to be just a little bit more cautious if you are taking medicines. It's probably worth checking for nutritional deficiencies. The food we're eating these days just is not as nutritionally replete. We're not getting as much sunlight exposure, getting vitamin D. Be aware that your alcohol tolerance may drop when on a ketogenic diet. And if you're on medications, again, it's very likely that you may need some help to titrate off of those medicines. So find a team or find someone that you feel confident working with to help you do that. And that is all I have. So thanks for joining.